love that feedback though after our procedure is done. I know that you all can sympathize with how difficult it is to speak in your classrooms, to do some public speaking in your classrooms in front of a room of 30 students. So I know you can imagine how vulnerable it feels to be in this space. Space by itself is intimidating, so pack it with your friends, your family, and I know that you can sympathize with our speakers today. But what they have to share with you is so profoundly important. We have 3 speakers this block who have fully engaged in health science research, workplace shadowing, academic paper writing, and the creating of a product to inspire others. I know that many of you have experienced some of those presentations and can attest to the value of what you're about to see. Our first presenter is Ordonez. Please welcome her.
Hello everyone, and thank you Ms. Grace for that wonderful introduction. I'd like to thank you all for being here to see my presentation. As she mentioned, my name is Ordonez, and today I will be talking about my senior project, The Realm of Anesthesiology. My project explores the various types of anesthesia and the role of an anesthesiologist in a surgical setting. Before we dive more into my project, I actually want to take us back to a monumental moment in everyone's lives, 2020, the rise of COVID, and the quarantine lockdown. With the world shutting down, no school, and remote learning, many of us were given what felt like an endless amount of free time. Out of curiosity, how did you guys spend your quarantine? Ethan?
I was watching Minecraft Dreamverse for Manhunters.
Savannah?
Listen to One Direction.
Sounds like me. Julia?
I was playing Minecraft.
Sounds like you and Ethan need to get together. Nice year. Very, very relatable. So for me, I personally spent my abundance of free time doing less than productive activities like scrolling for hours on TikTok, and once getting bored of that, switching over to YouTube, and I took countless naps, played many rounds of bingo with my grandma and my brother, and of course, started my journey on becoming the biggest One Direction fan. Quarantine became monumental in my life for a different reason. On first impressions, the way I spent my days was unproductive, but it had actually led me to discovering my unrelenting passion and the topic of my senior project. While spending those hours online, a YouTube video showcasing the day in the life of an anesthesiologist popped up on my recommended feed. By the end of the video, I was hooked and went on to watching more and more and more and more videos about anesthesiology, and I honestly haven't escaped the rabbit hole since. Generally speaking, anesthesiology is the field associated with pain management and critical care through the administration of anesthesia. This includes pain management both during procedures and recovery for after a procedure. Anesthesia can be then further divided into 3 or 4 categories, that being local, regional, and general anesthesia, as well as MAC, which stands for monitored anesthesia care. This is also commonly known as sedation. So the distinguishing factors between these different categories are mainly how they are administered and the level of consciousness of the patient. So local anesthesia is associated with minimally invasive procedures where the medication is either injected or applied topically to block pain in smaller and localized areas, such as getting lidocaine injected into your gums during a tooth extraction. Next up is regional anesthesia, which is a step up from local, so it deals with numbing larger regions of the body by targeting specific nerve bundles to block pain signals from being transmitted into the brain. So an example of this would be an epidural during childbirth where it numbs the lower half of the body. And then we have general anesthesia, which is perceived as the most commonly known division, where a person is made to be completely unconscious through either inhaled gas, IV, or a combination of both. And this is for more major and complex surgeries. The final type, sedation, is similar to general anesthesia, however it is distinct because the patient is not completely unconscious. MAC is actually a spectrum where consciousness can range, so you can be very deeply sedated or light. The result of sedation is for the patient to be more relaxed and comfortable, where they can still breathe and have some functions on their own without having the pain or memory associated with a procedure. I know that was a lot of information all at once about anesthesia, and to some of you it may sound monotonous or boring or just went in one ear or out the other. But don't worry, as I went through my project, I was able to acquire this information. So fresh out of my 7th grade YouTube rabbit hole, I was captivated because of how anesthesiology was depicted. I took away how incredibly vital the field is to modern medicine by making life-saving procedures possible. The combination of hands-on involvement, meticulous pharmacology, and essentially being a patient's guardian angel throughout their case are all reasons why I became so powerfully drawn to anesthesia. Fast forward to high school and coming here to attend the Math and Science Academy at Ocean Lakes, this senior capstone project was always on my horizon. It would serve as the perfect opportunity for me to see if all of the elements of anesthesia that I love through my phone screen would actually translate into real life, the career, and what I would come to witness during shadowing in my project. I was so fortunate to have spent my summer shadowing Dr. Schutte, anesthesiologist and director of the Centera Princess Anne Ambulatory Surgical Center. I was able to shadow Dr. Schutte throughout his day at the ASC and while he was on call at the hospital across the street. I learned an overflowing amount about anesthesiology with Dr. Schutte's help, and I could not have asked for a better mentor or experience. Once securing my shadowing, it was time for me to hone in on what I really wanted to gain and learn from it. The primary objective I had was to really determine what anesthesiology is. This was my umbrella question, as it was the broadest question of mine, but it had led me to developing other implicit questions that further guided my project and helped me to get a comprehensive understanding of the field. This included determining the roles and the responsibilities of the anesthesiologist. I wanted to know the minute details and the nuances of what they do beyond what I could see in those YouTube videos or read online. Because I was shadowing Dr. Schutte in the Ambulatory Surgical Center, which dealt with outpatient procedures, another one of my objectives was to observe what anesthesia looked like in an outpatient setting and how that may have differed from what you would expect in a typical hospital. I also wanted to know what an anesthesiologist must consider when crafting an anesthetic plan for each patient and their decision-making process behind that. And finally, my most important objective personally was to see if anesthesiology was truly all I was making it out to be, and if it was something I could really see myself pursuing as a career. Since I was relatively certain that I wanted to pursue anesthesiology as the topic of my senior project relatively early in my high school journey, I really took every opportunity to prepare for it. So the summer after my freshman year, I had my first opportunity to shadow my aunt, who was a CRNA. I had then conducted my first iSearch exploration during my sophomore year on the effects of anesthesia, and I also took MSA Human Anatomy and Physiology during my junior year. These experiences served as a great foundation to lay the groundwork for what I would come to learn. Prior to shadowing my mentor, I was mainly familiarized with general anesthesia because it's what I came across most during my research and when I observed my aunt. I carried prior knowledge about some processes and the environments associated with general anesthesia, such as intubation, ventilation, as well as the anesthetic gas setup in the operating room. However, since Dr. Schutte worked in an outpatient setting at the ASC, as mentioned, my experiences in general anesthesia were helpful, but I found that regional anesthesia was very predominant in the outpatient setting. So my shadowing took place over only 3 days. However, they were all very long days, often starting as early as 7 in the morning, lasting until very late in the afternoon. The majority of my time was spent following Dr. Schutte as he walked around from patient to patient preoperatively to discuss their procedure from an anesthesia standpoint. I will forever be grateful for Dr. Schutte taking the time to break down these complex topics and explain everything that was going on, as well as answering my many questions along the way. Although I came in feeling pretty prepared thanks to my prior capacity building, nothing could have prepared me for the amount of fast-paced speed walking I had to do to keep up with Dr. Schutte's long strides as we traversed between patient rooms, operating rooms, and his office. You can see from the picture that just came up that his one stride was probably equivalent to about 2 of mine. So by the end of my shadowing, I not only gained immense respect for the responsibilities carried out by Dr. Schutte, but also gained stronger leg muscles. On a more serious note, shadowing at the ASC was a fast-paced environment, as Dr. Schutte was the supervising anesthesiologist for multiple operating rooms that were each individually manned by a CRNA. Dr. Schutte always began by looking at the patient's medical chart to become familiar with the case and know any factors to talk about during his anesthesia assessment and confirm the anesthesia plan. He would then go to the patient's room, introduce himself, and discuss the anesthesia plan for the case. He would then verbally and physically assess the patient's condition to ensure that no vital information was missed that could possibly jeopardize the patient's health during the surgery. As I was observing him do these assessments, I got to recognize patterns in what to look out for in patient conditions and for anesthesia purposes. He would then perform any necessary nerve blocks and or administer sedating medications to get the patients ready for their procedure, which they would be transported to the OR for. The CRNAs would then take over and stay with the patient throughout their procedure. In the picture of the empty operating room on the left side near the bed, where all the tubes and wires are, is the anesthesia machine. So that's where the CRNAs would stay to monitor the patient and deliver necessary medications. This whole process would be repeated for many patients until all of the cases were done for the day. It was amazing to witness the team dynamic of the ASC between the nurses, doctors, and CRNAs, as it was very efficient while also prioritizing patient safety. Overall, I learned an overwhelming amount of information and gained an invaluable experience from my shadowing thanks to Dr. Schutte. It genuinely surpassed all of my expectations and left me more eager about the field of anesthesiology. I now desire to share my newfound knowledge with others. For my product, I always imagined it to be on further education of others, and I wanted my own opportunity to explore topics that was mentioned in my shadowing, reinforce what I had learned, and possibly inspire prospective anesthesia-interested peers. As I brainstormed for this project, the idea of creating an educational presentation to teach a class always lingered in my mind, but I was always slightly reluctant to pursue it in fear that I would lack real engagement and interests from students. I can recall being a junior myself last year, being in the audience for several of these senior projects, and I could honestly admit I was prone to zoning out during these long presentations. However, through continuous revision of my idea and feedback from others, I determined a way to put my own twist on a class presentation in order to transform it into something that allowed me to achieve my goals of exploration, reinforcement, education, and engagement. So my product was a slideshow presentation to the MSA Human Anatomy and Physiology classes. To address my fears about the lack of engagement, I added an interactive TABA activity and finished off with a demonstration of how to intubate using a model mannequin. My slideshow was titled The Realm of Anesthesiology, and it went over various anesthesia topics, such as the divisions of anesthesia, common equipment, nerve blocks, and intubation. I was able to combine my knowledge from my shadowing as well as further research to form the content of the presentation as well as solidifying my own expertise. Because the presentation was pretty content heavy, containing some material that my audience has probably never seen before, implementing this TABA activity into my slides was very effective in reinforcing new information to students. Essentially, what this activity consists of is students being put into groups and given a collection of words related to topics I would discuss in my slideshow. Then, the words they were given can be seen on the left side of the screen, and at the start of my presentation, I asked the students to organize the words into different categories, even if one of the categories was simply an I don't know pile. As I went along my slides, I would have multiple breaks where the students were tasked to rearrange any of the words into new categories, or even make new categories or rearrange words in their current categories as they learned what the words meant. Although many of the terms may have been unfamiliar at first, and some of those groups did have that I don't know pile, by the end of my presentation, all of the terms were covered and that I don't know pile disappeared for all of the classes I taught. I'm really glad that I chose to add this activity into my product because I saw that students were actively engaged with what I was teaching them, and it allowed for great discussions and connections to be formed. The final part of my product, and my personal favorite part, is the intubation demonstration I did with a model mannequin. During my shadowing, I was taken back to the operating room when Dr. Schutte handed off patients to the CRNA. During these moments, he would assist the CRNA with initiating anesthesia, which sometimes included intubating the patient. This involves inserting a tube into the patient's trachea, aka their windpipe, in order to ventilate the patient during their procedure. After witnessing intubation during my shadowing, it circled back to the hands-on involvement piece that brought me to anesthesia in the first place. I realized that demonstrating this process could further fulfill my goal of engagement, and it was realistically something I could learn to perform myself. I was able to acquire some equipment such as the laryngoscope blades, endotracheal tubes, and an ambu bag, in addition to finding a mannequin off of Amazon that contained proper airway structures and inflatable lungs to show proper intubation techniques. Although my demonstration did simplify aspects of this process, it was still definitely a fun and interactive way for students to learn about a technique performed in anesthesia every day. And it also reinforced my own skills to be able to demonstrate on the spot to students. To assess the effectiveness of my product, I decided to make a pre and post presentation survey using Google Forms. I was able to gauge baseline knowledge and growth resulting from my presentation, as well as receive constructive feedback that I would take moving forward. Both the pre and post surveys asked students to rate their level of knowledge on different anesthesia topics that would be included in my presentation. Both surveys additionally asked if students had ever considered a career in anesthesiology. In the post-presentation survey specifically, there were 5 additional questions that were quiz-style, multiple-choice questions to assess recall, as well as my effectiveness in teaching those topics. The last question featured in my post-presentation survey was an open-ended place for feedback where students could know what they liked or disliked about my presentation or some areas I could improve upon. I was able to present to 2 of the MSA anatomy classes, so I collected a total of 52 responses to both of my surveys. The graphs that are currently on the screen shows the pre and post responses side by side for the questions asking students to rank their level of knowledge about and amount learned about topics of anesthesiology, nerve blocks, and intubation, where 1 was the least amount of knowledge and 5 was knowing a lot about the topic. As you can see from the graphs, before seeing my presentation, the majority of students reported not having a significant amount of knowledge about anesthesia. However, there was a significant increase in knowledge reported after seeing my presentation, with the majority of students reporting 4s and 5s, indicating that they learned a lot about that specific topic from my presentation. To further supplement those results, the scores from the quiz portion of my post-survey affirmed the learning that was previously reported. The majority of students were able to answer all of the quiz questions correctly, while all of them were able to score at least a 4 out of 5. Since one of my goals going into this project was to inspire interest in anesthesia, I was curious to see if my teaching allowed me to reach this goal. By asking students about their interests in the careers of anesthesiology before and after my presentation, it was pleasing to see that there was an increase in students at least possibly considering a career in the field. And finally, the open-ended feedback I received from my students was overwhelmingly positive. Notably, many responses highlighted how much students enjoyed the interactiveness of my presentation, including both the TABA activity and my mannequin demonstration. Many responses were also so kind as to compliment my presentation skills, saying that I was well-versed and knowledgeable about the topics that I went over. Overall, I'm so incredibly satisfied with the results I received, as I felt it accurately reflected the amount of work I put into this project. From these results, I can proudly conclude that my product was a success, as I reached my goals of exploration with the content I decided to include, reinforcement of what I learned, education to medically interested peers, and high levels of engagement as reported in my feedback. Not only did the students benefit from my teaching, but I feel like I grew the most from this whole process of creating and presenting my product. From having the responsibility of creating my own timeline and deadlines to ensure that this show got on the road, I was really a testament to the importance of time management and actually being proactive to get things done. As a naturally more reserved person, I really flourished in my self-confidence and ability to engage a room full of people. Senior Project has given me many opportunities to practice my public speaking skills, such as the stage I'm on right now, and my public speaking skills have definitely benefited from it. This journey has taught me that learning never ends. Just because I had finished my shadowing or then finished my research for product content, there was still always room for me to learn more about anesthesia as well as gain soft skills throughout my journey. I expect to continue learning new things every day, long after giving this presentation, graduation, college, and beyond. I can confidently say that 7th grade me was really onto something, and anesthesiology is definitely a path that I want to continue to pursue. So what's next for me is I have chosen to continue this path, as I will be attending the University of Virginia in the fall, majoring in biomedical engineering on a pre-med track in hopes of one day becoming an anesthesiologist. This project would not have been possible with everyone that surrounded me throughout this whole journey, so I have a couple thank yous to give. First off, I'd like to give the biggest thanks to Ms. Graves for her guidance and support throughout this whole journey. Another big thank you to my wonderful mentor, Dr. Schutte, for allowing me more exposure into the realm of anesthesiology and for answering all of my many, many questions. Of course, I want to say thank you to my family for their constant support and love, not only through this project, but since the day I was born. And finally, to you guys, my audience, for being so wonderful and coming out to my presentation today. Thank you so much. I will now be taking any questions. What was the most rewarding part of my shadowing experience? My most rewarding part was definitely just being in the hospital environment, because being a doctor was always something that I dreamed of since I was very, very young, and like putting on the scrubs and just being in the environment with all the doctors and nurses, it was very rewarding to know that my dreams were actually possible. Shelby? The question was there any emergencies that I witnessed during my shadowing, or was it all just smooth sailing? For the most part, it was smooth sailing, and I feel like that's what you'd hope going into a hospital procedure. But there was one complication that I remember was you're supposed to not eat before your procedure, and because it increased risks of aspiration or fluid going into your lungs when you have your anesthesia. But the patient accidentally ate watermelon like the morning of their procedure, and it threw off the entire day because they had to get rescheduled. And it was just unfortunate to see that they couldn't get their procedure done that same day. Yeah, I'm back.
So one of the times I had to go under, they gave me the option to have the IV anesthesia in addition to what the gas that they were going to give me. Would there ever be any situations where like the IV beforehand would have to be required, or is it generally an option up to the patient?
So the question was, since anesthesia can be a combination of IV or gas, is it always the IVs required? The answer to that is, I know that they administered a lot of sedating medications through the IV, such as propofol, and that would just get the patient more relaxed, while the gas would actually keep them under.
Time for one more question.
So how long does it usually take until like the anesthesia like fully kicks in?
So the question was, how long does the anesthetic actually take to fully kick in? From what I saw, when they injected the propofol, it was almost pretty instant. It was really, really cool to see how the pharmacology really played a role, especially like when the patient is completely unconscious. It's really up to the CRNA or anesthesiologist to monitor their vitals, and they have to like really be on like their blood pressure and things, and you could see instantly the medication kicking in and working.
Excellent job. Most of you are staying with us. Now's a great time to pull out those Chromebooks, visit the Bitly link, post it around the room, and give our speakers some feedback. All right. Thank you.